Cervical cancer is the fourth most common cancer in women worldwide, and each year in the United States, the human papillomavirus known as HPV is linked to 35,000 new cases of cancer in both women and men. Due to the rising number of cases, the CDC, Centers for Disease Control, recommends that both girls and boys get the HPV vaccine between the ages of 11 and 12. And here with more information, because we think this is so important for us all to learn more about, is pediatrician and spokeswoman for the American Academy of Pediatrics, Dr. Lauren Crosby. Lauren, thanks for coming in. Giselle and I talk about this a lot because we feel like as mothers, we didn't know what we didn't know. Explain what the HPV virus is and what it can cause.
So HPV stands for human papillomavirus. So this is a virus. There are over 100 strains of this virus, but there are certain strains that are called high-risk HPV, certain strains that cause all kinds of infections from warts. Basic warts are in that family. Genital warts are in that family, and certain types of cancers also are caused by this virus.
And you get this through sex?
So intimate skin-to-skin contact doesn't actually have to be sexual intercourse. So that's why 80% of people come down with at least one strain in their lifetime.
So here's the, I think there's a big messaging problem around this. I'm a mother of a 13-year-old, and when they said, we want to give your daughter this HPV vaccine now between the ages of 11 and 12, I'm like, my kid's not even anywhere near, having sex, so why should she have it? Can you explain that to mothers who are asking the very same questions? I had to be convinced for her to have these 2 injections.
Right, so the way we're really trying to present this now is that this is a way to prevent cancer. So who wants cancer, right? So if you can prevent certain types of cancer, then why not do it? You also want to give it early because it works better. So we found that the immunity is long lasting and a more robust immune response in the younger people, in the preteens and the early teens. So we try and get in 2 doses before they turn 15 years old.
It used to be 3.
It used to be 3. And so we found that because the immunity is so good, you actually don't need that 3rd shot if you get it early. So it's actually better. So our patients who have waited because they have had concerns and wanted more information, they need 3 doses if they've hit their 15th birthday. So
has there been any data that we've seen that's shown that the reduce of spreading the virus, now that we know that it seems to be working as far as actually getting the vaccine and being vaccinated, is it working as far as not spreading it?
It's actually working very, very well. So there's a big decrease, 86% decrease in HPV infections in young women.
Oh, wow.
So that's huge.
That's huge.
Huge. 40% decrease in precancers in women in general, also, which is huge. And they're still studying more data. But, I mean, this virus causes most cancers of the cervix, or abnormal pap smears. If you've ever had one or you have a friend who does, and then they're chasing this abnormal pap smear and they have to keep going for follow-up testing because they're worried because it's precancer, you don't want that. So if you can now prevent that, plus something else that isn't really talked about is if you have it and you birth your child vaginally, you can pass an infection even on to the baby. So now if young women are getting this vaccine, it could even prevent that.
I'm concerned about people in underserved communities because it's not just about doing a copay, it's about somebody taking off work to take their kid.
And their messaging around it.
And the messaging around it. So I think it's true, like you said, I think it needs to be better, but I think, talking about this and saying, just like you get your whooping cough shot, the Tdap, you get your HPV, and it just should, and I think it's getting more normalized now.
Part of that package.
Yeah,
All
and
right.
if schools can give it,
Lauren, we love when you come in.
We love when you come in. It's so understandable. Thank you so much.
Thank you.
Thanks for
And
having
listen,
me.
for more information, folks, do visit healthychildren.org. You've heard it here. Your kids need it. And like Giselle, we have to get educated.